Designs for Health is the nutritional supplement brand of choice, exclusively recommended by healthcare professionals.
As a physician, I insist on the science-first approach of Designs for Health. They have synergistic formulations with optimum quantities of therapeutic nutrients.
Designs for Health, the leader in professional brand nutritional supplements.
There's a new secret to looking younger. An advancement so profound, it took a team of scientists years to create. A time machine called Zoom. Getting zoomed is the fastest way to erase years from your looks. Zoom is the most advanced teeth whitening ever. Only your dentist has it. Nothing works like it. Zoom Gel gently penetrates the submicron pores of tooth enamel. The patented Zoom Light super activates the gel through a unique photofenton reaction, breaking down the stain's double bonds. In just 45 minutes, years of discoloration disappear, transforming your smile to wow. To find a Zoom dentist near you, go to zoomnow.com or call 800-891-4895. For your whitest, most confident, most irresistible smile, get zoomed today. Make your appointment at zoomnow.com or call 800-891-4895 today and discover the wow of Zoom.
You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. My first guest needs no introduction. He is Las Vegas's most popular cosmetic dentist, Dr. Mike Golpa. Dr. Golpa. Okay,
Randy.
so you brought some of your work.
Well, I brought some of the pictures of my patients. With this patient, she never was happy with her smile, and
she has a pretty nice smile.
She's got a pretty nice smile, but she wasn't happy with the canines, with the eye tooth, and they're pointy. They were crowding on the left side, and they were cross-bite, meaning the right side of the jaw was the teeth were too far in on top comparing to the lower teeth. So
when she comes to you and you're there on the consult, what do you see when you're looking at this?
Well, what we see is basically the arch on top is very narrow. We need to widen the arch. The teeth need to be lengthened just slightly because to follow the lip curvature, we always consider the lower lip line to see exactly how the relationship between the lower lip and the upper teeth.
So on this before photo, okay, you want those teeth to follow the lower lip? Is that what you're saying?
That little change by lengthening the teeth and widening the arch and following the lower lip line, it's going to change her smile from having a good smile to a world-class smile, which you can see it on the after picture.
Beautiful.
And she was a model, but in all her pictures that she was taking previously, she wasn't smiling. And
you said you have a picture of her.
I have a picture of her.
Not smiling as a model.
Not smiling, and she's got this different pose. In none of them, she's smiling, because she was just so...
It bothered her.
Yeah, it bothered her. You know, she was always concerned about it.
So help me understand. Okay, so I look at this after. What am I looking at? What makes that such a great smile?
What you're looking at is basically is the length of the front central teeth, and then looking at the lower lip line, and looking at the smile line, we can see more teeth in the back on the corner of the mouth, which basically gives the patient a more positive smile. And now she's gorgeous. She's just beautiful. So happy. She's so happy. Now let me show you this. I mean, we get patients who have pretty good smile, but they want to notch it up. Now, Randy, I want you to just look at the before close-up shots of her teeth.
But she has a great smile.
She's got a good smile, but then she was in a dental field, and she was embarrassed from her smile because her
so she was pickier than most.
Yeah, she was so picky, and she didn't want to have all these chipped teeth, and you can see the corner of the mouth. The upper arch was very narrow, and that will give a patient a negative smile.
So what did you do for her?
What we did is we went ahead and we put upper veneers. We did corrected her bite. Her bite needed to be opened up.
All right.
So look at the bottom teeth. We went ahead and did the upper veneers already, and then the lower teeth was the one that was standing out because it was so imperfect. You know, it wasn't. It was a lot of crowding.
So veneers on the bottom, veneers on the top.
Veneers on bottom, veneers on top. Now look at the lower on the after, and
perfectly straight.
This is her after, and she's basically
so
she's
like a model.
Soccer mom actually, and she's like so happy. You know, she's got 2 great kids. She's basically so happy about her smile. And
so this is a subtle change.
This is a subtle change, but you know that small difference made a big change in her life, in her smile. You know, and cosmetic dentistry is not for everyone. everyone. But that smallest change that can make a big difference in your smile and can improve your life, it's like...
I mean, she's a knockout now.
I mean, you look at these teeth, you know, a lot of people, they're concerned about veneers. Maybe it's going to look too long. They're going to look like a horse teeth.
Well, I feel like I could spot them 10 yards away.
I mean, it all depends who was...
That's in the hands of the dentist?
The dentist and the lab technician has a lot to do with it. Let me show you this next patient. Basically, she's a student and she wasn't happy with her smile. As she was biting, you could actually see her tongue because she
that's with her mouth closed.
Yeah, that's with her mouth closed.
What's that called?
We call it open bite. So the patient had extreme open bite, and it was pretty complicated to get the ideal bite, but that's all I do. That's, you know, we do a lot of full mouth reconstruction. We come up with the ideal bite position. And here's her after, and she was thrilled and she was so happy.
Huge difference.
There's a difference between what she looks like now.
That's right.
I mean, she looks like, you know, she wants to go and have a party or
fun,
she's like,
you know?
like, she's all happy and she's smiling and everything, comparing to what she was before, and she wasn't smiling before.
Well, she looked like very young there, like a kid. Now she looks like a woman.
You know, I mean, don't you think this
so it is life changing?
Kid's life changed a lot. You know,
it
has a big impact. You know,
did they tell you that people treat them differently?
People treat them differently. People, you know.
And did they say that?
They, you know, they're more respected. Let me show you another one. This patient, he was actually a management of a big firm, and he was never smiling. And I know it looks pretty nasty, but
looks pretty bad.
It looks pretty bad.
That's gotta be rare, though. That's rare to see something like that.
No, it's not rare at all. You know, there are a lot of people out there who are not smiling. So
you just don't see it. I guess we don't see it.
I guess, yeah, you don't see it.
So he comes to you.
And what happened is after we placed 2-3 implants on him, and we went ahead and did a full mouth reconstruction. 3 weeks after we did the full mouth reconstruction, he got a promotion at his job. So
is that right?
I mean, it made a huge difference in his
I think when we show those side by side on the screen,
you know,
a huge difference.
It's a huge difference.
Something to be very proud of. And so what do they say? I mean, they call you Dr. Golpa?
They tell me about the stories. You know, they tell me about what happened at their jobs, you know, how their smile affected their job and their social life, their personal life, their health. And this guy's job was affected in every way. He's dating now. He wasn't dating before. One of my favorite patients, she was a owner of a big mortgage company, and this is her bite, her close-up shot. And this is with her mouth closing, actually. So the only thing was touching was the back molars. I mean, look at her. This is her bite.
So this little side view.
This is a side view. Her mouth is actually closed. And I mean, look at her face. She's such a nice lady. She's so happy. You can see that. But you can't see it on her face.
So she just doesn't smile.
And
is that what she tells you?
She has over 145 employees.
Right?
And who would, I mean, she wouldn't be able to...
So she was insecure about it?
Yeah, she was so insecure about her smile. And look at her now.
Wow.
This is after doing a full mouth reconstruction and closing the bite.
I mean, a woman like that, successful, puts it off, doesn't do anything about her smile. Is it just fear of the dentist, the pain?
One thing is fear. First of all my procedure gets done under IV sedation.
IV sedation, okay.
And if they want deeper sedation, we do have an anesthesiologist on board that comes in.
Okay.
So that is, they will not have any recollection of, you know, the surgery. But this patient didn't think anything was possible for her. She did have the money, but she didn't know if there's any option available for her. So she was
she just felt her teeth were too far gone?
Was too far gone, and there was too much decay, and her bite was an issue. She thought she might need some advanced type of oral surgery done to her jaw.
I mean, when you saw her on that consult, I mean, and you say you consider yourself an artist, do you see the end result? That means when you look at her and you say, oh, this is going to be great. I see the end result. See, what we do take a before mold of the teeth, and we do study model on these teeth to see exactly how the teeth is going to look like before we even do anything. So the patient's in on the process.
The patient is in the process.
There's no surprises?
There is no surprises. We don't like surprises. So
you show them like charts or teeth models?
It's just like doing the surgery, doing the process before we even do anything. So we know exactly on the model how the teeth is going to look like after we're done.
Now they get temporaries. I mean, veneer patients get temporaries.
They get temporaries. And that's going to be a good study guide for us to see exactly where we're going, you know, if we are on the right track.